Hi, I'm Dr. David Hill, and today we're going to be talking about allergic contact dermatitis in infants. That's a mouthful. What are we talking about? Well, contact dermatitis is a rash. Particularly, it's a rash that results from having some sort of physical contact with an allergen, or in other words, the thing that causes the rash. So, what are common allergens in infants? The most common allergen to cause a contact dermatitis in an infant is a diaper. Usually it is some sort of dye or scent in disposable diapers. They're made with all sorts of scents and dyes to make them look pretty and make them smell good in a situation where you might not really expect them to smell good. And those chemicals can react with your infant's skin in a way that causes contact dermatitis. Usually that rash is red, it tends to be itchy or irritating, and often your clue is that it follows the pattern of where the contact is. A lot of diapers will be kind of green or blue along the edges, and if you see that the rash tracks those edges, it's a pretty good clue that it's a contact of that dye. Likewise, if you notice in the diaper area that the skin is red where it touches the diaper and not red, the rash doesn't exist where skin touches skin, where it's protected from the diaper, that's a great sign as well that your baby may have a contact dermatitis. Now, of course, you can get contact dermatitis from other things as well. I'd be looking at lotions. If a lotion has a pretty color or smells good, I always get really suspicious because the things that make it look pretty and smell pretty, you see a theme here, are also the things that can cause allergies. So when I look for a lotion or a cream for infants, I always look for one that is white or clear in color and really has no smell whatsoever. Now, you may get a contact dermatitis from certain foods. That, of course, is going to be around the mouth, at least if that's where the food went. Anybody who's ever fed an infant knows that's not always where it stays, but look for that pattern of food touching the mouth and then some redness or bumps or hives in that area. Strawberries will do that. Any fruit will do that. A variety of other complicated foods like spaghetti sauce may have some allergens in them. So you can pretty much bet if you see redness around the mouth after feeding a baby a food that, yeah, there may be a contact dermatitis. You might want to hold off on that one for 6 months or a year and try it again later. Talking about allergic contact dermatitis in children and babies, I'm Dr. David Hill.